There is some confusion still, because it is not always straightforward. My husband always had a heart murmur. So, for example, I thought, okay, we can tell by people that have heart murmurs. But then I found out that some bicuspid aortic valves, they don't make any sound. They're silent. The valve may be abnormal, but may be silent.
They need to know the presence of a bicuspid aortic valve in the family is a risk factor. Other members of the family may not necessarily be bicuspid, but the recent research has shown that even though they might have a tri-leaflet aortic valve, they still might have elements of thoracic aortic disease and aneurysm of their aorta.
When Dr. Raissi was speaking about those families where one member of the family may have a bicuspid aortic valve, another member may have a normal appearing number of leaflets and still have thoracic aortic disease. It appeared in the literature, and we had put information out about that, but when my husband's sister had her surgery, I found out that's the case in our own family. She had all 3 leaflets, and yet she has many aspects of connective tissue disorder in her.
So there's a lot we don't know, and there's a lot we need to learn. But I think to the present time, we would like to keep our eyes open and follow up the families very carefully and analyze their imaging studies in an intelligent way. And in the cases that we are not sure what degree of aortic disease is present, to follow these patients carefully in the future. I think presence of a member of a family with thoracic aortic disease is a red flag that one has to take it seriously, needs to look at the entire family and try to be proactive and finding a patient with this disease that otherwise might go undetected and end up in a tragedy.
And in addition to that, I should touch on brain aneurysms. It has not affected my own family, but on our board of directors, we have a very dear friend of mine who I met. She was been very supportive and instrumental in bringing the foundation into being. I was present with her the day that she was told that she had an aneurysm behind her left eye. She already knew she had a bicuspid aortic valve. She knew she had an aneurysm of about 4 centimeters in her chest. She did not know that she had an aneurysm in her brain. And it's not in everybody, but knowing that, of course, my own family, they would be screened. They have not had that manifestation of a brain aneurysm, but I do know other families where it was important for them to find that out. So not only have we learned that we need to be careful about the chest, we need to remember the head and neck vessels as well.
Yeah, it's really to see a patient doing well and going back to their active lifestyle and loving family is a quite rewarding experience. However, on the same page, you really think that there are a lot of patients that they're not necessarily they have received the same results, whether they're unknown or they're waiting for some emergency to happen, and because they're not diagnosed, and constantly gives you this feeling of potentially another life, another patient is vulnerable. So we don't know exactly how many patients die as a result of thoracic aortic disease, and that's pretty scary. So it gives us really a mixed emotion that as much as it's rewarding to see one patient does well, that some patients may not, and they're jeopardized. One of the difficulties with patients with thoracic aortic disease is it really becomes a major issue in a very most productive part of their lives. In their sports, family, children, in the middle of their career, very healthy, happy, active lifestyle, and then they become, without any warning, they become severely vulnerable. Some instances they die. A very healthy young athlete that dies in the court. Or they dissect and their entire course of their life changes. Our patients come and they end up in the right settings, and they have their operation, and they go back to their full active lifestyle. We had a fortunate example of a young basketball player that was in a very rapid progressive course of their disease, and within less than a year his ascending aorta had progressed to a dangerous large diameter, and in the middle of very busy basketball season he had to opt to go for surgery. And it was very heartwarming to see this young man has gone back to his entire full, active, capable basketball career, and to see him running and performing so well on a basketball court. Unfortunately, we had sad stories of two young football players. That one died, very healthy, very active. It was quite a tragedy for the family of this young man. However, same family, his brother, knowing and learning from what happened, he underwent appropriate imaging studies and found out that him himself, being a young another football player, that he did have a true aneurysm in his chest, and he underwent appropriate surgery, and he, in a very short time, within 3 to 4 days, discharged from the hospital, go back to his full active lifestyle, bearing the happiness of having one child survive. Their parents were in tears to see how they could have one of their sons back, having lost their other son. So it was quite a mixed emotional day for them and for us, but this just emphasizes how important it is and how serious this disease is, that appropriately patients be followed, be diagnosed, and be treated.
As Dr. Raissi said, it's joy and sorrow mixed together, but it's something that cannot be ignored. We're looking for a better future than even we have presently.